Cauda Equina Syndrome is a condition which affects the spine, and it's where the discs within the spine come slightly out of place and press on the surrounding nerves or the spinal cord.
It is considered by medical experts as the only non-traumatic back condition that is an emergency.
Doctors and clinicians should know what to look out for in a patient suffering from Cauda Equina Syndrome and how urgent treatment is required.
Treatment of Cauda Equina Syndrome is often time critical, and so unfortunately many people find that their condition isn't recognised and they're not given treatment quickly enough, and they end up with very life-changing and permanent injuries.
So it impacts in the lower back and it impacts upon the sacral nerves, resulting in potentially very significant damage to bladder, bowel, sexual dysfunction. It is also associated with development of radiculopathy and neuropathic pain symptoms.
Healthcare practitioners don't always ask patients the questions that they need to enable the patient and them to realise that they're suffering with symptoms that need urgent investigation.
There are very clear what we call red flag symptoms for Cauda Equina, which should be taken seriously by any medical practitioner and acted upon urgently.
That might be a change in bladder or bowel habit, or pain and other symptoms in the legs.
It can cause problems with bowel movement, urinary function, sexual dysfunction, which overall is absolutely devastating.
Cases of the maximum severity in Cauda Equina can be cases worth well in excess of £1 million.
If appropriate treatment had been provided within the initial 48-hour period, their lives could be totally different now.
They are cases that can, in the context of their symptoms, ruin somebody's life.
Fortunately, Cauda Equina Syndrome is a rare condition, but unfortunately, because of that, people do find that it's not recognised and treated quickly enough.
Often back pain is a relatively modest problem, and rest and recuperation will resolve that. But in the case of Cauda Equina, the effects are devastating.
If somebody's condition has taken a long time to diagnose, or they've waited a long time for surgery and they've been left with permanent injuries, then that will often lead to them wanting to look into the standard treatment that they've received and to make a claim.
But the process of pursuing compensation claims means that often we can help them in terms of care, we help them in terms of accommodation, but we also can help in terms of recovering costs of treatment. So whilst the outcomes for clients can be very devastating, the process of compensation can help improve their life.